The video is for educational purposes only, and that the information presented in this video is not a substitute for medical advice or diagnosis. Before auscultation, greet and listen to the patient talk. Also listen to the patient cough. You'll be using the diaphragm, the stethoscope, to listen to lung sounds. Beginning lung auscultations, hand your patient a gown if needed and have the patient sit upright, slightly leaning forward. When auscultating the chest, make sure to listen to one complete respiratory cycle at each site. Alternate and compare sides. Ensure to listen in the intercostal space and not over bone. Here is a normal breath sound. Here is an abnormal sound of crackles. Here is an example of a diminished breath sound. When auscultating from the side, ensure to listen between ribs and at 3 sites. Here is an example of wheezes. Here is an example of rhonchi. When auscultating from the back, ensure to stay off of bone and continue to listen between bony areas. Ensure to listen at multiple sites for both the upper and lower lobes. Here is an example of pleural rub. Here is an example of stridor. When heard, it can indicate an upper airway obstruction. Here is a normal vesicular sound.